All right. Hi, Anna. Welcome to the podcast, the Postpartum Performance Podcast. I'm so happy to have you here. Welcome to the show.
Thank you. I'm so excited to be here. This is so great.
Happy to have you. So before we get started, I want you to just kind of introduce yourself a little bit and what you do, and just tell the listeners a little bit about yourself and what you're excited about right now.
Yeah, absolutely. So I'm a chiropractor, and actually my husband, Jacob, and I are both chiropractors, and he comes from a big, long line of chiropractors too. And we practice in Cardiff by the Sea, California, like North County, San Diego. And I'm really passionate about all things health. I'm one of those you'd call them like crunchy gals. So I love natural beauty, natural remedies, homemade remedies, things like that, supplements, nutrition, fitness, all of the like, because your body's designed to heal itself when given the right opportunity and taken care of. So I'm all for focusing on healing the body in the best ways possible.
Awesome. So to touch on, so you said Jacob comes from a line of a lot of chiropractors in his family.
Oh,
So
yeah.
how did you get into chiropractic specifically? Was it before meeting Jacob, or was it after?
Yeah.
What's that story? You can go down that.
It's a crazy story. It's a crazy story, but to make a long story short, Jacob and I started dating when we were in high school. I was 15 and he was 16 years old. We met in Spanish class, and so we started dating, and I had been an athlete my whole life. I played soccer for 9 years. I was a gymnast, did volleyball, like all the things, right? And I started getting these headaches, and they turned into migraines as I got older and into high school. And then Jacob and I started dating, and I still had these headaches, and they'd come and go. They weren't like crazy often, but they were still there. And I was 15 years old. So what's that about? And he finally goes, hey, you should go see my parents, because both of his parents are chiropractors. And I was like, I'm 15. Like, I don't have neck pain. I don't have back pain. Why do I need to go see a chiropractor? And he's like, just go. Trust me. So I go in, and ever since I started getting adjusted, and specifically the curves of my spine corrected, I haven't had a single migraine since.
Wow.
And it completely changed my life. I don't get headaches like at all. It allowed me to pursue my dreams and continue to do my sports and activities that I love throughout college, and stay incredibly active to this day. So in high school, that really inspired me to become a chiropractor. I was like, oh my gosh, I want to do this. I changed my life. But at the time, Jacob didn't want to be a chiropractor. So I felt really weird being like, hey, I want to do what your parents do. Like, how do I do that? And he goes, but I didn't say that. But I still wanted to help people. I loved helping people. I really wanted to work with people, as well as in some form of health industry, in the health and wellness industry. And so applying to colleges, my mom goes, hey, what about nursing? I said, that's a great idea. And so I actually went to Point Loma Nazarene University here in San Diego for nursing school. I got halfway through nursing school and loved it, like loved learning about the body and healing and everything like that. And then halfway through, there came this time where I quickly realized it just wasn't for me. I kept seeing all my friends around me, my roommates, so passionate about nursing and what they were doing, and excited going through clinicals and everything. And I just didn't have that passion. And I was like, what is this? Why don't I feel as excited as my friends? Like, why? And around that time, when I was silently questioning all these things, Jacob's parents actually came down to San Diego to hear this famous chiropractor speak, Dr. Jim Sigafus. He recently passed away, but they invited me to go join them and then get dinner, yada, yada. In that moment, when I was hearing this chiropractor speak, it was like the biggest slap in the face I've ever had in my life. Like, getting the chills, everything of like, oh my gosh, this is what I wanted to do. This is what I expected and thought, for some reason, what nursing was going to be like. This is what I'm called to do. And so I'm like innerly freaking out. My heart is like pounding. And so I just knew, that feeling of like deep down, you just know. And yeah, so then I'm like a horrible daughter, and I went to school the next day and changed my major to nutrition without even calling my parents. So
Oh my
that
gosh.
conversation was fun, but
Oh my
yeah,
gosh.
so I ended up doing nutrition, finishing up with that, and then going to chiropractic college. And around that time, Jacob was actually studying abroad in Spain. He went to school for business. And then while he was studying abroad, he found himself constantly talking about chiropractic, chiropractic, chiropractic. And so when he came home from that around this same time, he was like, hey, I want to be a chiropractor. And we're like, how cool.
That's awesome. That's such a
So
unique but special like story that you guys both have, but personally too for you, that kind of realization for
yeah,
sure.
definitely. Glad it worked out, right?
Yeah. And like sticking to like that feeling of like you're almost your intuition a little bit of like,
Yes.
like I'm going down this path, but it's okay to change that path, especially when
Yeah.
you feel like, oh, that's totally what I've been called to do. Absolutely.
Hmm.
Oh,
Yeah.
that's
And then
so
I had
amazing.
that passion that I saw my friends have for nursing. And so that just, whatever you're passionate about, you just got to dive in and go for it, because you're just going to, why not? First off, why not? What do you have to
Hmm.
lose? And you just don't want to be kicking yourself later in life saying, oh, I wish I knew I wanted to do this, but I didn't. So take those opportunities.
Absolutely. I love that. So, within your chiropractic care, I know you see a little bit more of a certain population. I know you see a little bit of everything, but which population is exciting to you
Yeah.
and why?
I love working with women. Women are my favorite to work with because I get it. Like, I'm a woman. So it's just easy to connect in that sense. And it's funny, when I was in chiropractic college, I really wanted to work with athletes. And then it switched. I really wanted to work with pregnant women and moms and babies and kids. And then getting into practice for the past few years, it still changes. It always changes, right? But what I found, just over and over again, is I love just connecting with women and helping women specifically with hormones and navigating that. I see a lot of women who are trying to get pregnant. I see a lot of women throughout their pregnancy, and then postpartum, of course, taking care of their kids as well as after giving birth, because that's no joke.
Right. Yeah. That's
Yeah.
so we're here to kind of open up the eyes and share the knowledge about kind of what healthcare practitioners can do within that women's health scope. So you
Yeah.
mentioned a little bit more on, so you went for your undergrad for nutrition, and then you also
Hmm.
mentioned you enjoy kind of helping navigate with some of the hormone things, which I feel like most people, when they
Hmm.
think chiropractor, they're like, what? I don't think most people would pair that with that, but with your experience, and we
Yeah.
were talking about this before, you're really excited about some of the cycle syncing method things that are kind of
Hmm.
becoming a little bit talked about and I think need to be talked about more. So I would love to hear your kind of why you're excited about the cycle syncing and what you do for clients that are looking either to get pregnant for the first time or for after having kids and kind of that hormone side of things and what that looks like.
Oh, yeah, absolutely. So where to begin?
I know there's so much.
I know. Well, first off, hormones are such a mystery. I feel like in this world, especially today, like it's 2020, shouldn't we like know a little bit more about hormones and how to navigate them, and all these
Mhm.
women going through menopause and premenopause, and it can get wild. I remember being in high school and seeing my mom go through menopause, and it was like the craziest thing I've ever seen in my life. She would cry when she'd see a squirrel outside. And I was like,
Mm.
what is it? Yeah, we laugh about it now. It's okay. But it's just a wild time, right? And even working with some of my younger clients that are still in their 20s and 30s and haven't gone through menopause yet and aren't there yet, talking about your period and your cycle, and especially painful periods, those where you feel so irritable, painful cramps, low back pain, all of the like headaches for the first day or maybe longer, or maybe a week before throughout your entire cycle. It depends. And so I've worked with a lot of women through um, working with the spine specifically. I'm a chiropractor. What else am I going to
Mhm.
do? And also coaching them nutritionally to see how they can support their body in the best way possible, especially going into working with their cycles. So we were just talking, I'm reading this book right now that is just blowing my mind, and it's called In the Flow
Yes.
by Elisa
Vidi.
Vitti.
Yep.
We're going to go
Such a
with
good
Vitti.
one. Yeah.
Yes.
I
Yes.
know
Oh my gosh.
it mind blowing and just so much about it. So go ahead,
So much
share.
information.
Yes.
Oh my gosh, there's so much information. Well, I just started the book, but it's incredible. One of my roommate from chiropractic college actually introduced me to the book. And the whole idea is that all of these fitness and nutritional guides and recommendations and a lot of the studies are based on the men's 24-hour sleep wake cycle, and not necessarily on a woman's 28-day cycle, plus or minus 28 days, right? Mm-hmm. And so eating and working out and taking care of your body based on those phases of your cycle, right? So I find it so fascinating with how you should work out, based on where you're at in your cycle, pre-ovulation, post-ovulation, the first day of your period, and the like. So I work with a lot of my patients talking about nutrition, especially if they have cramps and painful periods. That is so common, but it is never normal at any age. It's never normal. Same with headaches, same with low back pain. I see it all the time, but it is honestly never normal at any age. Yes, it is common, but that doesn't make it okay at all. So we talk a lot about function and how to heal. Your body's ability to function is so related to your health, right? Obviously. And so I have this one patient, if I can tell a quick story, this is just so cool. This is why I do what I do, because this makes me so excited. But she's in her mid-20s, and she first came to me. She was told she had scoliosis in her low to mid back area. You know, when we're all in junior high and the nurses come in PE class and we like bend forward and they tell us like, oh, you have scoliosis or not. But that's it. There's never any follow-up. It's just kind of like, oh, okay, cool. But of course in junior high, we really have no idea what's going on.
Of all the times too, we're like more body conscious and stuff, or like freaking out. We're like, what?
I know, at any little thing. So anyway, she was told at a very young age that she had scoliosis, but nothing really became of it. When she went to the doctor and got an x-ray when she was very young, they said, yeah, you have scoliosis, but you have to wait till it gets worse to do anything about it. And for the past 50 or 60 years now, the only solution to scoliosis has been surgery and putting a rod in your spine. And I personally have seen x-rays of rods being bent, because that doesn't correct the spine, that just makes you immobile, right? And the body's just going to keep doing what it's going to do if you don't correct the actual issue. So that's crazy to see a rod bent in somebody's spine, I'll tell you that much. But so she never had the surgery, and because I wouldn't let her because it wasn't bad enough. So she kept living her life. And then as she got older and into her 20s, she had more and more low back pain. And when she came in and I took her history and learned more about her and what's going on, she told me that her periods are so bad that the entire time when she's on her cycle, she cannot get out of bed. She can't speak. She can't eat. She can't talk with her husband. They're so bad. I'm like, okay, that's a red flag right there. That's not okay. And then we took her x-rays, and she had over 30 degrees of scoliosis. And scoliosis is considered anything above 20 degrees is pretty bad. So she had over 30 degree scoliosis. It had grown over 15 degrees within, I think it was 6 or 7 years, which is crazy. Wow. So if you don't do anything about it, what's going to happen? It's going to stay the same, or it's going to get worse, right? If you don't change your habits, it's same with nutrition, same with fitness. If you don't change your habits, nothing's going to change, right? You can't expect it to magically get better. So anyway, she has been under care for about 4 months now. And we got her scoliosis down from over 30 degrees, and now it's under 20. So she technically doesn't have scoliosis, but it's not perfect. She's not perfectly straight at all, but she definitely is on that direction. And the coolest thing she told me, after about 2.5 months of care, she came in and she grabs my arm and she's like, I have to tell you something. And I'm like, oh my gosh, what? And she goes, I had my period last week, and it was the first time in my entire life where I could get out of bed and eat and have a life while on my period.
That's amazing.
That is incredible. And the whole basis behind it is in your low back, in the same position she had that scoliosis, that curve in her low back. Nerves from your spinal cord are exiting, going straight to your reproductive organs. And so they exit at the level of the spine where she had her scoliosis, compressing those nerves. It's not like cutting off a nerve, no, but that compression, the control that goes to those reproductive organs, they're not able to heal as properly. They're not able to function as they were designed to, right? So she was having incredibly painful periods to the point where obviously she couldn't do anything, but taking just millimeters of pressure off of those nerves exiting the spine at that level allows the body to heal, allows those organs to function as they were designed. So that is just one of the many stories that we see in our office. We specialize in correcting the curves of the spine, so we specialize in scoliosis, but it's always so cool to hear the personal stories of patients of, yeah, I came in for low back pain, but I left and my digestion got way better. My period pains. Yeah, exactly. So that's what I love working with, is helping women through those times.
Absolutely. And I think the holistic approach that you guys take is pretty awesome, because it's yes, it's focused on obviously chiropractic care, but it's more than that. And I think that's so important, that it's treating the patient as a person first and foremost.
Totally.
And I think that's fantastic. You guys always do such a great job with your patients and the people that I've seen in your community.
Thanks.
I'm curious. So if you want to dive in a little bit more on, so if you have someone coming to you and they mention like, oh, I'm also having painful periods, or I'm getting these headaches. Aside from the chiropractic care, nutrition wise, what are you recommending, or what are you looking for, or what are you maybe having people consider with their nutrition?
Yeah, well, my deep belief, especially with nutrition, is and with everything, fitness, chiropractic, everything, everyone is different, right? Not one diet is good for everyone. Not one fitness routine is good for everyone. Not one way of getting adjusted is great for everyone. So I really like to hone in on their history, their habits already, and make it sustainable. Because how many fad diets are out there right now? And how many of us have tried those fad diets? Hello.
Way too many.
Yes, way too many. And I've seriously almost tried all of them, which is crazy. But so I really like to hone in on what's going on with them too. And if they have blood work or anything like that, we work with that as well. But specifically let's go with headaches first. Headaches are caused by a lack of oxygen to the brain. And so I recommend a lot of things with headaches, but if they have intense migraines associated with that as well, migraines are typically threefold: structural, nutritional, and hormonal. In our office, of course, we're dealing with the structural, and I like to add on top of that the nutritional. And most of the time, if you take care of those two things, the hormonal shortly follows. So that nutritional aspect, if they're really nothing is helping them at all, I tell them go 6 weeks or 45 days, no gluten, no dairy, no sugar, no alcohol, no caffeine. It's really difficult, but it's more than doable. And if health is a two-way street, right? I can give you all the tools, but you're the only person in control of your health, right? So
yeah. I think, and those things too, that I think people to keep in mind, and even just for women postpartum, or whether they're not postpartum, or just general health and wellness, is some of those asks, I guess you would say, or recommendations from someone like Anna would be, it's only 45 days. I like to think about it that way.
I know.
You've had, headaches, or you've had this pain for this long, like what's 45 days of trying something to see if it'll potentially resolve that and make a change, and actually see change, I think is huge. Because then I like to leave the ball in their court. It's like, you've learned now that X, Y, and Z is affecting your symptoms. It's your choice now to consume or drink or whatever, whatever specific individual thing that it is to them, or that combination of stuff. And I think
Yeah.
it's
Yeah.
powerful with being able to encourage and support people in that too. So
Oh
that's huge.
yeah. Oh yeah. I mean, it's hard too. Sometimes you just want to take a patient and shake them and wake them up and be like, "Can you just
Yeah.
do this? Trust me, like it'll help so much." I see it over and over and over and over again. So, um, Jacob and I practice in the same practice that his parents practice in. So all four of us work in the same office.
Hmm.
And actually, as of yesterday, the practice has been open for 30 years.
Oh,
Yesterday was the
wow.
30-year
Congrats.
anniversary. Yeah, thanks. It's
That's
really, obviously I
fantastic.
haven't been there for 30 years,
Yeah.
but yeah, they have officially been there for 30 years. And I could tell you story after story after story of the healing that takes place when you look at the body as a whole, like what we were talking about. It's the 5 essentials of health, of chiropractic focused on your nervous system and your neurology, right? That's your nervous system. So that's why chiropractic is first, then nutrition, exercise, um, toxins, minimizing those as best you can, and then also mindset. So that's what we focus on in the office to get those results.
Awesome. I like it. So for the women that you see postpartum,
Mm-hmm.
what what would you say to them that where if they come in and they're like, I wish I would have known this sooner, whatever that kind of phrase is. I know it comes up in many conversations that I have with patients and the women that I work with. What's something that you've tend to seen or more of a trend potentially with that population?
Sure, yeah. So it's interesting when I see pregnant women in the office, the best thing is getting them early. The earlier, the better in their pregnancy, because the second you get pregnant, you have relaxin, a hormone pumping through your blood, and it does exactly what it sounds like. It relaxes your ligaments, your muscles, your tendons, and everything of the like. So, a lot of things can shift, and we want them to shift and grow because you're growing a little baby in there. It needs room to spread
Mhm.
out.
Yeah.
But at the same time, your pelvis can shift out of that natural alignment. And I call your sacrum, it's like the trap door of labor. So with every contraction, opens up and closes, opens up and closes as baby gets deeper and deeper in the pelvic bowl. So having a balanced pelvis and making sure either door of that trap door, that sacrum,
Hmm.
is moving properly is key for having an efficient labor process. Not easy, but efficient.
Yeah.
And so for these moms that I'm seeing throughout their entire pregnancy, we really focus on stability of the pelvis and making sure it's moving properly so that they can have that really effective labor process. And then for the moms that I only see 1 or 2 times before they go into labor, or I had this one mom, for example, for her first baby, she came to me. I only adjusted her once, and she was, I want to say, she was over a week past her due date. And she goes, "Get this baby out of me." And she goes, "I have a lot of friends who have come here who they went into labor the same day they got their adjustment. It just helps to speed things up when you're at the end." And so she goes, "Get this baby out of me." And so we get her adjusted, and she goes into labor the next day and has the baby. And it was a really long labor, like over 30 hours of
Wow.
labor. It was really difficult. And then she got pregnant with her second child recently. She just had the baby last month, but when she got pregnant with her second, the second she found out, she came in and got adjusted throughout her entire pregnancy. And when she had the baby, it was less than 8 hours of a labor.
Wow. That's
And
a big difference.
yes,
Mhm.
incredibly different labor with both of those kids. So, to answer that original question, what I hear most is, "I wish I would have seen you sooner," or "I wish I would have known sooner." Um, the stability of the pelvis is huge, especially going into labor, and especially with relaxin in your blood. It just can change so quickly. We work a lot with the ligaments too, the round ligament. It
Mhm.
suspends on either side of the pelvis. It suspends your uterus in the pelvic bowl. So
Mhm.
before you're pregnant, it's 4 millimeters. And then at the end of your pregnancy, it can stretch up to 17 to 18 millimeters long.
That's
So it has
like it's so
quite a
crazy.
ways to go. I know.
The
How is
human
that even
body,
possible, right?
human
I
body
know.
is
Oh, it's
so
insane.
so amazing.
It is. It's incredible. So that that's a lot to go throughout your entire pregnancy. So we work a lot with those ligaments, making sure one side isn't tighter or pulling more than the other side, so that the uterus can be suspended evenly within the pelvic bowl versus shifting one side or the other, making for a longer, less efficient labor process. So yes.
Interesting. I wanted to circle back on when you were talking about the sacrum and the trapdoor stuff.
Yeah.
For listeners that have had SI joint dysfunction of some sort,
Mm-hmm.
have you seen if it's more likely or less likely if they have some, like I would say, like a hypermobility to
Mm-hmm.
that once they also become pregnant with some of the hormones? Do you see that become more of an issue, or does it can change? Or for people that come in, if they were like, I've never had SI or like
Mm-hmm.
sacrum type things, have you noticed any correlation or anything specific with that?
Yeah, absolutely. So I have a patient who was a dancer for like all of her life, a professional dancer as well. And she had just injured her SI joint, one of her SI joints, over and over and over again. Okay. So when she got pregnant, it just exacerbated that pain. So throughout her entire pregnancy, it's been all about getting some stability there, because with the relaxin, you're just moving all over the place. And it is that hypermobile patient because she's already more flexible. And so that hypermobility I've seen both. It can be your best friend or your worst enemy, depending on, has it been injured? What's your history like? What does the exam show? Things of that nature. So what I really focus on with that hypermobile patient that's a little bit unstable is bringing some stability to that pelvis. Have you seen those support pelvic bands?
Yep. Mm-hmm.
Yeah,
Yeah.
those are great. You can find them on Amazon too. They're really great.
Mm-hmm.
I recommend those for those patients, but only during any kind of movement. Don't wear it when you're sitting on your couch or hanging out or laying down, because we need your pelvic to change and move. Movement is life.
Mm-hmm.
But to get some more stability within those joints, wearing it when you're on a walk, when you're doing the dishes, anything like that, just to gain a little bit more stability there. So does that
Yeah.
answer your question?
Yeah,
Okay.
no, for sure. And I think, and it's important to know that like with that stability, talking about that belt, like Anna mentioned, you want to make sure that you're wearing the belt, again, not during the all the time things. That's the same thing for those
Yes.
muscles to know, hey, I need to be stabilizing within that and helping support this area too with the growth of that. So yeah, supplementing with the supportive stabilizing exercises. And then when you have certain activities like a walk or prolonged standing and some of that stuff, to be knowing like, okay, well, things are changing, but if I really need to, yes, I can use that support as a supplement, and knowing that that's a good tool in the toolbox.
Yes.
Absolutely.
Absolutely. I like it calling it as a supplement
Mm-hmm.
versus your crutch.
Yeah. Yeah. It's like not
Yes.
the main dish. It's like the side dish. Just
Yes. Yeah, exactly.
a little bit on the side.
Yeah.
Um, so back to I'm curious about some nutrition stuff. What stuff are you
Mhm.
excited about with nutrition right now? Whether that's with the
Mm.
cycle syncing stuff that we were talking about
Yeah.
before, or just personally, what's something that you are like so into right now, whether that was through some of the quarantine stuff or just because it's kind of the fall, or what's
Hmm.
nutrition things would you be saying like right now, this is for you?
Yeah. Well, it's funny. My friends, we were doing a little workout this morning and they were talking all about the new fall stuff hitting the shelves at Trader Joe's right
All
now.
pumpkin things. Yep.
Oh my gosh. And I'll tell you what, I love that, but I just cannot come to the realization that it's going to be fall and not
Same.
just yet. I need more summertime
I
to
need like
keep
it
it
to be
going.
October, and then I'm like,
Yes.
okay, I can take on the pumpkin stuff now.
It's still too hot. It's way too hot to be fall yet. So
Yeah.
I'm waiting for that, but I will jump on all those fall goodies. Um, But right now, I'm really excited about the seed cycling. So,
Okay.
basing it off of that book and the flow that I'm reading, and it really breaks it down into which phase of your cycle you should be eating which type of foods. And it's not restrictive at all. It's based on just how you can support your body and your hormones in the best way possible at the right time, too. So, seed cycling is a part of that. And I always laughed whenever I heard I was seed cycling. Like you can just eat a bunch of seeds, nuts and seeds.
Mhm.
Like, what are
Yeah.
you, a chipmunk? Like, what are you doing? But, no, it's amazing how it helps to just support your body at all times. So I don't want to get this wrong. I don't want to say the wrong timing for each one, but
Mhm.
essentially the first week, if we're looking at a calendar and your period is the last week of the calendar. And the first week, so right after your period, you should be eating, don't quote me on this, but like pumpkin seeds. And the next phase should be sesame seeds. The next phase, we should probably Google and get the actual right ones that we need to be saying.
Yeah, but
But
it's really
it's
interesting
really
though.
fascinating.
Mhm.
And what kinds of fats you should be eating at which time of your full 28 to however long
Mhm.
cycle. So I've been really jamming with that, eating a lot of healthy fats. I am such a fan of healthy fats, like coconut and nuts and seeds, avocado oil. I eat a lot of fish and a lot of seafood. And so, yeah, that's what I'm really excited about right
I'm
now is
digging it.
focusing on balancing the hormones.
That's so good. I think there's so many ways to do that. And I think the book makes it so
Hmm.
much more tangible and also like natural. And I think that's
Yes.
so good where you just have to kind of check in more with your body, which I think is a
Hmm.
really important thing for many women to just know, okay, like this is this time of my cycle where a lot of people just kind of wait until like, oh, I guess my period's here. And they don't really know sometimes. So it really almost like it gamifies it a little bit. I think of like
Yeah.
knowing like, oh, this time of the month is coming up. What should I like be filling my grocery cart with?
Hmm.
Rather than just picking some of your favorites. And then you realize with the hormones, like your digestion changes too. And so some of that of like whatever foods that you're having, I think that's so cool though. You're like, oh yeah, I have this today. Oh, that makes sense. Or in hindsight, I found when I was reading that book that like certain foods, you're like, oh yeah, if you're like craving this or feel better eating this during like this and that, I'm like, oh, that totally makes sense now.
Right.
So highly
Yeah.
recommend the book for those of you.
Yes.
It's a good
Yes.
one.
It
It is.
is.
All right. So to wrap up today, I wanted to, well, one question was what exercise and movement routine, what does that look like for you right now in this season? And then also what type of exercise brings you joy right now?
Oh, they're the same. I
Good.
really
Okay.
love, yeah. I really love HIIT workouts, high intensity interval training. That is my jam. That is what I love. And I like to do those workouts Monday, Wednesday, Friday. And then on Tuesday, Thursdays, I either go for a walk or do yoga. And I have been so, so sad with hot yoga being shut
Mm-hmm.
down recently. Well, I guess for the past 5 months, but
Yeah.
that has been hard. But doing that now, I just do that in my living room and watch a yoga video on YouTube. So
Mm-hmm.
still getting it in and keeping up my strength as well as flexibility. And I'll go for a walk like almost every day. I love, especially when you live in a place like San Diego, how could you not get outside all
Yeah.
year
We're
long?
blessed for that. We're blessed for that for
Yes,
sure.
definitely.
I think I feel like I met you when you were hosting that one hit training thing at the church.
Yeah,
I think that was you were doing like a hit training series or
yeah.
something. And that's actually where I met.
Definitely. Yeah,
Yay.
I call that was my burst workout. So I did that with our church, and then I did that in the office. I probably do it like 2 times a year. And then with quarantine and COVID, obviously we haven't done it, but I can't wait to get back into that because that is so much fun.
That was so good. I was like, who is this girl? I was like, this is so fun. But very good time. I enjoyed it nonetheless.
Oh, good. I'm glad.
Nonetheless, yeah. I always love finding other people that are passionate about health, wellness, fitness, nutrition, like
Yeah.
all of those things are so fantastic. And um, cycling back into, I guess, with women postpartum,
Mhm.
this is a question that I like to ask all of my guests. What advice would you give to a new mom struggling with staying healthy and finding her new routine as a mother? So you're
Oh,
leaving a coffee shop and a mom's asks you, hey, I have a question for you.
Mhm.
How do I do this? I'm struggling.
Yeah, absolutely. I would say give yourself some grace. First and foremost,
Amen.
give yourself some grace. And then secondly, take it a day at a time. And I get asked a lot, how do you stay so motivated and, I don't know, continue to eat clean or exercise, whatever it may be? You don't. Motivation comes and goes, but it's building habits that make it last. And how you build a habit is you have to start somewhere. So I would say give yourself some grace and just start. You just have to start, because I think we've all felt that at least once, I feel almost every time when you start working out or when you eat clean for a day, if you do like one day of just like, hey, oh my gosh, let me pat myself on the back. Like, I feel so good about myself. And then
Mhm.
you start to get in a rhythm and you crave that feeling of, I'm really proud of myself and I feel fantastic. But you have to start somewhere. So the advice I would give would be just start. You have to just get into it, because then you can find your routine. And it doesn't have to be every day. It doesn't have to be even every other day, but just start somewhere, some kind of movement, some kind of that like self-care of what you're eating and how you're taking care of yourself, because you won't be able to take care of anyone else in the family, let alone a little cutie newborn,
Mhm.
if you don't take care of yourself first.
That is
So yeah.
fantastic, fantastic advice. Grace, and then getting started and taking that action.
Mm-hmm.
Absolutely. Yeah. Perfect. Well, Dr. Anna, I thank you so much for being on the show.
Thank
If
you.
any listeners would like to get a hold of you, ask you any questions or just kind of, or see you or anything like that, where's the best place to find you?
Yeah, well, on my socials, they can find me on Instagram. My Instagram handle that you can find me at is the.fresh.pursuit. And then you can find me on my website, which is actually brand new as of today.
Ooh,
I just got it
congrats.
completely redone,
It's
so I'm super
launched.
excited about it. Yeah, it's launched. Get after it. So that is thefreshpursuit.com, and you can find a lot of my blog posts on there with healthy recipes, different types of workouts. I have a whole blog post on pregnancy and chiropractic and how to support yourself best during pregnancy through nutrition and fitness and everything of the sort. So you can find all those goodies at thefreshpursuit.com. And it also has a little tab on there, how to book an appointment with me if you'd like, with a little discount code attached to it as well.
Fabulous. So I'll be sure to put that in the show notes so that listeners can get a hold of you. Thank you again, Anna, for jumping on the
Yeah.
show with me today. You are such a light, and I appreciate you for being
Oh,
on
thank you
here.
so
It was
much.
so
It's
good.
such an honor to be on your brand new podcast.
I
I
know.
love
Thank
it.
you.
I
Thank
love
you.
it.
Awesome. Well, we'll talk to you soon.
Sounds good.